Bula Vinaka and welcome to Close Up. The COVID-19 pandemic is more than a health and social crisis. Fijians who have been affected by the economic impact of the pandemic are struggling as many are forced to stay at home. On the show tonight, we speak to some Fijians struggling during this crisis and an NGO making a difference by assisting those who need help the most. That's coming up in the next half hour. The second wave of the COVID-19 outbreak, including the lockdown, has been challenging for many Fijians. Casual workers who rely on day-to-day salary are one of the most impacted by the crisis. For taxi drivers, the lockdown and early curfew hours means less runs and loss of income. He adds some families are relying on the government initiatives for their daily livelihood. As the COVID-19 cases continue to increase, so does the challenges faced by many Fijians to put food on the table. Permanent Secretary for Health, Dr. James Fong, is aware that COVID-19 is more than a health crisis and had this to say in a press conference this week.
Sotava chikong baleta na bugni COVID-19 pe atchungo ona kau bawan din takatal chunga ya tete chiko o wakilani sa singin dona bono na lakumikina na kakana sa vinanga me nda tete nga me bakanga ni chiko weekend na yo mandanga nungu chiko ya o chiko bira na tuta tokeningele o babina kataka ni ndo sele tu na panoya mi ndo tete tukina o babina kataka chiko ni solitu ni rawani techukina na kakana yo mai bandina dinataka ni dagana lockdown go o maruta kani kana chiko o maruta ka chiko o kanga songa nakalalai ndondono me mai bolinga bakanga na suka na masima iyo kwanga na kena po sa tete na ruro kana ruro tunga wata kena tavioka o so na kaya raya dongo era na via bagantin dinata kambaleta ni rasyangani tete iyo ranangani vakila na tamata ndo rani ndo tete.
Yeah, we're facing in the hard time because it's a 4 days lockdown and it's no job for us, and we're giving income to the owners. It's now it's very hard for us, and today the thing is open, and we still the people is moving is not plenty, slowly, and we're going to see tomorrow what's going on. Yeah, it's better we just follow the government what they're saying. It's 6 o'clock is a bit of lockdown. It's better if we're going to follow the things, better the quicker, and we can follow the things, and then the job is going to be flow again.
The biggest challenge is that people don't have money, and taxi is a luxury item. The necessity is food, not taxi. So we have more than 70% drop in our business, and still we have to give our owners. They are reasonable. They're caring, they made it half the income, but still it's hard to make. Survival is very hard now. You have to work morning to afternoon, and as you know, it is 6 p.m. curfew now, so we have to be home early. You can't pull time. It's a very hard time for everyone, especially when we are in the supermarket. We see how people buy, what they buy, and what they take. That is what the hardship we face. It's all financial.
So just how are you coping during these hard times?
Well, have to sacrifice a lot. What's your interest, needs and wants, we have to take into consideration a lot. Yeah, and we have to avoid any loss, any extra cooking, saving, cook one time, eat two times. That's how we survive. I'm in a better position, but people are in more worse position. If you go and really look deep into them, the hardship what they face. I would say that government is coping well. The food rations, that $92 they're given to those who need it. That's a big help in, when someone is drowning, a straw is very big for them. And that $92, that ration, that has given survival for many of the people who really are in need, desperate need. Yeah. Hope that we will be back to normal sooner rather than later, but everything is in God's hand.
Yeah, I feel that pain. There is a difficult. I mentioned about the new normal. The fact that we have to try and discover a path forward. And this is one of the reasons why we mentioned a lot about businesses coming up with COVID-safe plans. We need to start looking at how they can operate and keep themselves COVID-safe. For example, there is some contractors that have decided that they will sequester themselves as a bubble. And they will have different sets of workers staying together at the work site, sequester themselves, do whatever work they need to do. And when they finish the work, they go. So they form their own bubble and they work within their own bubble. They will keep their COVID-contained space, but there will not be any mixing of bubbles. That's an example. There's some other ones where we have clarified, like, for example, the movement of freight, fuel, and food. We've decided, okay, only the truck moves across. The drivers, you need one driver at one end and another driver at the other end. So those are but examples of things that can be done. But I have to be honest here. We've now asked the Ministry of MCTT, that includes the word trade. Now they will need to take on that world of business and understand the world of business and try to figure out how we can make business run in a COVID-safe way.
Stay with us. After the break, we will speak to the director of the Foundation for Rural Integrated Enterprises and Development. The Foundation for Rural Integrated Enterprises and Development, or commonly known as FRIEND, is a homegrown NGO working towards poverty alleviation through social and economic empowerment. FRIEND Fiji Director Shashi Kiran says the focus for the organization is to assist families in the Lautoka and Nandi containment area.
FRIEND is Foundation for Rural Integrated Enterprises and Development. It's a development NGO. Started 20 years ago. We are headquartered in Tuvu, Lautoka, though we operate all over Fiji on socioeconomic and health empowerment programs. What it means is we do loads of training, setup of income generation, setup of organic farms, and we also do disaster response. So over the last year, you would have heard a lot of us in news because we've been trying to respond to COVID crisis, evolving COVID crisis, largely with food support, with medicine support, and with livelihood support. And since lockdown, we have ramped up our support for people who are struggling at the moment, particularly in lockdown, Lautoka and Nandi. We run two programs that are on phone calls, one or rather on requests. One is the food distribution, and we receive roughly 300 requests per day. That's via Google form, as well as through referrals, through different organizations and government organizations. And that's quite a lot for us to assess and process. And we have delivery in Lautoka, 4 teams delivering in Nandi and 2 teams or 3 teams delivering in Lautoka. So we are responding to food need. But we beg of people that we're trying to really support people who are in squatters and informal settlements, people who have not had an income for 4 to 5 weeks, they have no savings, no FNPF, no support whatsoever. We're trying to provide food for them. We have constant calls from mothers with babies who've run out of baby milk. Yesterday, there was a case where a mother called from between Lotoka and Nandi, and she said her baby has been drinking warm water for the last few days. We couldn't believe it, so we checked with a neighbor, because a lot of people put baby in front to ask for assistance. And so we checked with a neighbor, and it was verified, and then we had to, almost curfew time, we had to go and give milk. And there was another urgent case in Vomo Street. So 2 cases, almost on a daily basis, we are seeing mothers struggling to provide milk for babies, and of course the food.
Friend Fiji has stocked up NCD medication that are not available at the Ministry of Health for Lotoka containment area.
Generally, we know that government supplies pharmacies do not have the full set of NCD medication. And generally, when we've been providing food, we've been seeing that people have prescription medicine, but they're not able to afford. The children are no longer working. So we were trying to assist people with medication supply through pharmacies. But more recently, we've partnered with Ministry of Health. What we do is we have developed a telehealth system where there's a short code 165. People are able to call. These are the people who are diabetics, hypertensive, NCD patients who cannot go to a clinic. They have not been able to go to a clinic for the last 4 or 5 weeks because of the situation in Lotoka. And so they are able to call, and we've hired general practitioners to respond to these calls. So people are able to call through the switchboard. We transfer them to a general practitioner who talks to them, checks the past prescription, and organizes the medicine. And we have bought the Lotoka pharmacy, Lotoka Hospital Pharmacy, all the medications they don't have on the list. So all the things that they don't have from the government supplies, we have purchased it for them, and it's sitting at Gurmit Center. So when the doctor receives this call, we have developed a telehealth platform with the support of Digicel. So each doctor is able to type in, and the pharmacy at Gurmit Center is able to receive that information, and they're able to pack the medication. So people who are capable are able to come and collect it. And if there are people who cannot collect it, then my team collects it and delivers the medication to them. So we're just trying to make sure that the very basics, food and medicines, are covered, specifically for NCDs, because we know with diabetes and hypertensives, if they're not on medication, they're in high stress situation right now, and they could be evolving a lot more complications that could be quite difficult for them to manage in due course.
Since the lockdown, Friend Fiji has distributed 4,000 food bags in the Lotoka and Nandi area.
We have distributed, by the end of this week, we would have distributed about 4,000 food packs. And we have about 12 staff involved in Lotoka, and so we have a mixture of staff, volunteers, and some other organization staff are also involved with us. So in total, we have about 25 people working full-time on just assessing calls, doing deliveries, and so on. And it's not easy because we have Lotoka lockdown and Nandi lockdown, and we have to transfer food from Lotoka to Nandi. Food is, the weight and all that. So on a daily basis, we are processing food applications at the moment.
Kiran says families in the West are struggling to put food on the table, adding Nandi is the most affected.
Quite a painful situation, actually. For Lotoka, a lot of business had picked up. People were in employment, and now for the last 4 to 4 weeks, they have not been able to get money. And especially the casual workers who are hand to mouth have nothing to survive on. Many people, if they had a garden, they would have finished the garden by now, and it's really a struggle. You also remember people who were on short hours. There was one-off FNPF support for them. We are told that they are not eligible. So these are the people who are on short hours and now later, at home for 4 weeks. They're not able to avail FNPF. So there's that lot of people who have no support. And then there are people who are on FNPF from before, but because people cannot afford to pay rent, you would see they have moved into permanent homes or homes of relatives. So we have families, sometimes we cater for up to 30 people, 35 people in one household. So to survive that many people, that amount of food is a real struggle. For Lotoka and Nandi, also we have people from like outer islands, marine areas, Vanuatu, who could not go even when the lockdown opened. So we still have large numbers of people stuck in Lotoka and they're not able to feed their families. With Nandi was economically totally crippled in the past year. Towards the end of the year, we had seen a lot of people starting their small enterprises, picking life up again, and they have been dealt another blow and they are completely flattened. So the food need, support need, medication need is huge indeed. And people who were affording, who were middle class before, now in the last 1 year, they have finished using their savings and there is not a lot they can turn to. So Nandi is like the worst hit, I would say, all over Fiji in terms of lockdown, even though lockdown has, of course, had a mega issue in Lotoka, just like in any other area it would have been.
Stay with us. After the break, we continue our discussions with the director of Friend Fiji. Friend Fiji, like any other organization, also has challenges of its own. Kiran says she ensures the staff are safe and follow all COVID-safe measures when assisting people.
So for food, we are seeing, because there was a big government ration drive in Suva, I think a lot of people who think, okay, we're entitled. So even affording people are applying. That clogs our system because assessment takes much longer. We also have sometimes people, 2 or 3 people applying from our house, and so it just makes it a bit harder. Also, we have people who apply from extremely difficult to reach areas. And on a daily basis, when you have a baby kind of call, it's like some of the distances are quite far to travel. So the further you go, the less homes you are able to cover. We also have, so there are sections of people that we never think about. Like, for example, the juice sellers at the market had to close this stall ages ago. The kava mixers had, and these are very low income bracket. The shoe shine boys, the wheelbarrow boys, the widows, the domestic workers. So post first wave, a lot of domestic workers were laid off in Nandi. Many of them had started working, say, in Lotoka kind of areas, but are laid off now. Construction laborers, casual laborers who have never had FNPF, and very, very large families. So we're seeing the stress, and it's really difficult to cope. Also, when we had the request from the hospital, for example, to provide the NCD medication, we don't want people to come to a place and only get 2 medication and they need 5, and then they go to pharmacy, 1, they can't afford it, 2, it means so much more traveling. So even sourcing the medication has been a challenge, because we've been basically collecting from different pharmacies to be able to stock Lotoka for now. And then we want to do the same for Nandi. So because Nandi is far worse, and we want people to be able to access the NCD medication. So there are many challenges. The blocks are a challenge, the 2 containment zones where we have to transfer food. Potholes are a challenge. We have tire bursts, no tire repairs are open. So there are all kinds of challenges. And then one of the most difficult ones is keeping the staff safe. Making sure they have PPEs. It gets really hot, when they are taking their PPEs off, that they are doing it in a safe way. That's like constantly we have to keep talking and reminding about it. But staff safety is important for us. But at the same time, we had to discuss with the team that people are hungry. So while we have to keep safe, we have to also make sure that the people get food. And, those things do add up.
She acknowledged the assistance provided to the organization so that it is able to help those in need.
We've been very grateful. We have had citizens' donations. Lots of people have given us money, and we're trying to make sure dollar to dollar of that goes towards grocery. But I don't know how we're going to continue to meet the amount of demand that is out there.
Kiran believes that government can do more in assisting families in need and adds there is a need for a thought-out plan, a plan that ensures people have enough food.
I think government can do much more, and it is their responsibility to do much more. Quarantine families in Lotoka and Nandi, we had to provide support on a continuous basis. We are told economy is going to start providing that support. So one, people are anxious and they have been asked to self-quarantine. Health has enough on its plate and they're also very tasked to actually find food for them. So that's being covered. But I think really DISMAC needs to be activated, and Nandi, Lotoka, Ra, the lockdown areas need to be fed. That's a very basic. There are lots of other needs, social protection needs, there's domestic violence, there's medication needs, there's so many other things that we are trying to plug in. But really, it is the government's responsibility to make sure that people have food in this crisis. And we don't know how long is the crisis going to be prolonged. How many more babies are going to be going hungry in a country of plentiful? Also, I think there needs to be some thought through plans. For example, yasawas. Yasawas can come up to the main to the wharf if they can come and offload their fish, if it can go to the market to be made available, or even if we can purchase those things for food rations. Because yasawas was also very badly hit by tourism or the demise of tourism industry. These are the people who cannot sell their fish. They have no money to purchase, any grocery. And remember, they were hit by TC Yasa and TC Ana as well. So the gardens were very badly impacted as well. Yes, they have sea to rely on, but I think we need to start thinking and strategizing how can these symbiotic relationships between the communities can safely be managed, the interior of Ba, getting food in a safe way, so we can flood food. Instead of just purchasing from the processed food that we are giving in ration, we would like to give a bit more nutritious food, because malnutrition was already such a big challenge before. So yeah, I think much more can be done. We just need to engage with different partners and think about logistics. So Vanuatu is safe, which is great. Is there a possibility even from maritime for some level of food transfer to happen without people contact? I'm sure if we think it through in a COVID safe way, it can be done. So money will also be spread to other areas, and so we don't have to. Right now we are getting demands for food from yasawas. If they're able to bring the fish and be able to purchase it to put it in ration, at least they'll have money to be able to purchase their food. I mean, Lotoka and Nandi is big enough a worry for us. So I think other stakeholders and especially government needs to step up.
She adds a lot of people are struggling in the country and had this message to share.
It's difficult. I think it's going to be a bit more difficult in time to come. It's important that we can check on our neighbors, how they are doing, all for help. If we have a bit of extra, please share with your neighbors in terms of food. No contact is needed, put it at the gate. But I don't think in this country of plenty, we should be having people who are sleeping hungry, which is the case. Especially in informal and very poor settlements, we are seeing things that are absolutely heartbreaking. And I think that's why my team keeps pushing itself and doing it despite the difficulties that we are facing. So I call on the nation, have a soul, have a heart. Let's support the people in need. This is a phase, it'll go away. But while people are down, we need to give them a hand and lift them up, because we are all one people. And I also think it's very important, we as a nation are spending too much time and effort in, people who are COVID victims. They need our love and support. They do not need stigmatization from us. Each one of us could get infected tomorrow. And that, as a nation which calls itself very spiritual, I think we need to go in, look at what our spiritual values are, and be able to really emotionally and spiritually support the people going through COVID crisis in their families, as well as anybody who's going hungry.
Families in need of food relief in Lotoka and Nandi lockdown areas can apply using a form available on Friend Fiji website and Facebook page. Assistance will be provided to those who have been working in informal sectors. These are domestic workers, market vendors, casual workers with no access to FNPF and have been impacted by the lockdown. That was your close-up for this evening. For questions, please send us an email on news@fijitv.com.fg. Remember, stay at home and in your own bubble. Until next week, stay safe and good night.